Maybe 2 dogs that can't let it. No,
You get extra credit if you get extra credit if you get heckled and you can still talk.
No. I've had friends obviously in the middle of staring competitions at the beginning of this, so. Hello everyone, I'm Zach Wilson. There is an epidemic striking at the heart of American schools. It specifically targets children between 4 and 17 years of age and can cause nervous disorders, undue stress, and in severe cases, even death. What exactly is this epidemic that threatens the physical and mental health of American children? Well, I want you to picture yourself back in junior high. You're young, awkward, and trying to listen to a history lecture, but you're unsure of whether your crush who is sitting behind you thinks you're cute, and your friends are supposed to pick you up later tonight to sneak into an R-rated movie, and maybe you should invite him or her. Maybe you should check Instagram and see if he or she would liked your last post. Either way, class is over now, and you still know nothing about the 100 Years' War. Your teacher, who has noticed your grades slipping, has recommended you seeing a doctor. You might have ADHD. Your doctor sure thinks so. He gets a check from your insurance for a little piece of paper that you trade for a drug that's going to change your life. But this drug makes you feel weird, not yourself. You don't eat while on it, and you're finding it more and more difficult to sleep at night. Now you feel like you're left with a choice to either take the drug and feel weird or fail your classes. No, ADHD is not the epidemic. The threat that I'm speaking about is the overprescribing of dangerous stimulants to children with and to those without ADHD. The overprescription of ADHD medication is a complicated issue. As a mental disorder, it is very difficult to definitively diagnose and even more difficult to treat. Drugs have offered comfort to many patients suffering from similar conditions. However, such medication is meant to be a treatment of symptoms rather than an actual cure. Doctors are encouraged to treat and repeat by both pharmaceutical companies offering financial compensation for prescribing their drugs and by patients desiring a quick fix for their problems. The state of the pharmaceutical industry has made it difficult to find a practical solution to the overprescription of ADD meds. However, many drug manufacturers have already begun offering non-narcotic, non-stimulant alternatives to their stimulant medications. Awareness has also helped many parents to seek alternative treatments such as behavioral therapy. Overprescription of stimulants for the treatment of ADD and ADHD can affect children in a number of ways. The primary concerns with these drugs are the long list of physical and mental side effects and abuse of the medication. According to drug websites, side effects can include nervousness, dizziness, restless, headache, stomach ache, decreased appetite, sleeplessness, and dry mouth. These side effects, however, are only the result of stimulation of the central nervous system, during which heart rate and blood pressure are increased. Overstimulation poses a great risk to children taking ADD medication, or a greater risk to children taking ADD medication than to adults, and can cause cardiac arrest if the child or parent is unaware of the possible dangers of overstimulation. A review published in Brain and Behavior in 2012 outlined many cases of abuse of these drugs in children and adults with ADD and without ADD, who either obtained the drugs legally through prescription or illegally obtained them from their peers. This raises another concern about the misuse of drugs, the misuse of psychoactive stimulants, many of which were once sold on the streets as speed. I personally have known someone who died of cardiac arrest due to the misuse of what she called study aids. The overprescription of ADD medication is a multifaceted problem. It begins with overdiagnosis of the illness to begin with. According to the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, only 5% of children are expected to have ADD, yet the rate of diagnosis continues to rise above this figure every year. The American Centers of Disease Control and Prevention, or the CDC, has found that ADD diagnosis rates have increased by an average of 3% each year from 1997 to 2006, and by an average of 5% per year from 2013 to 2011. In 2011, 11% of children between the ages of 4 to 17 were diagnosed with ADD or ADHD. While kids today may face more distractions than before, an increase in actual ADD and ADHD occurrences is unlikely, although diagnosis rates are heavily affected. In many cases, children simply need to be taught how to focus. In addition to overdiagnosing patients, doctors are also not following AAP guidelines for treatment, which usually involve some combination of behavioral therapy and pharmaceuticals. In particular, the AAP guidelines do not suggest the use of stimulants in younger children when behavioral therapy is the primary treatment option. Behavioral therapy is often overlooked as a treatment option due to the patient's desire for a quick fix and financial subsidies by pharmaceutical companies to doctors who prescribe their drugs. Now, incentives to prescribed medication can be removed by changing the relationship between doctors and pharmaceutical companies and making it illegal to pay physicians to prescribe drugs made by these companies. Development of alternative non-stimulant medication by drug manufacturers, along with the steady removal of stimulant drugs from the market, can also lead to a decrease in frequency with which this medication is abused by children and adults with and without ADD. Physicians and healthcare specialists could create local action groups that encourage proper treatment of ADD and ADHD, as well as offering treatment with non-stimulant drugs or alternative treatments. If you agree that over-medication of ADD and ADHD is something that must be stopped, then help raise awareness amongst friends and family with ADD and children that have ADD about alternative treatments and non-stimulant medication. Over-medication of patients with ADD has led to concerns about patient health as well as abuse of the drugs. The overdiagnosis of children with ADD and the relationship between doctors and pharmaceutical companies has made overprescription a complicated problem to fix, although alternative medicines have been growing in popularity. Now, with reports of stimulant-related injuries associated with abuse of ADD medication rising, it is more important than ever to raise awareness about the harm that these drugs can cause. Thank you all very much for listening.
5 minutes. I found you.
Thank you.